Well, good evening and welcome to the It's My Turn, Becoming a Plasma Donor Hero webinar. My name is Jerry Williams and I am the founder and president of Myositis Support and Understanding. We are an all-volunteer, patient-centered nonprofit organization working to improve the day-to-day lives of myositis patients and caregivers. And an important part of what we do is collaboration to provide the community with education and awareness, along with many other things. But that's what we're doing today with the It's My Turn campaign for plasma donation. And we encourage your participation. Please submit your questions at any time by locating the Q&A icon in your Zoom toolbar. We will address as many questions as possible at the end of the presentation. Please do not submit questions in the chat section as they may be overlooked. This session is also being recorded and will be available for viewing on our website and social media channels within the next couple of days. So as I mentioned, today we're going to discuss plasma donation, and joining us from the Immunoglobulin National Society is Dr. Luba Sobolevsky and Rachel Coletta, and from CSI Pharmacy, Michelle Vogel and Dr. James Sheets. Dr. Luba Sobolevsky is the founding executive director of the Immunoglobulin National Society, and she's going to provide an overview of the role of plasma in the manufacturing of immunoglobulin and other therapies. Welcome, Dr. Sobolevsky, and thank you for joining us today.
Thank you so much, Jerry. Thank you for the introduction, and thank you, MSU, for inviting IgNS to speak this afternoon. I hope everyone who's tuning in today is doing well. And what I'd like to cover today are a few things. A little bit of an intro to Immunoglobulin National Society, or IgNS, if we haven't met before. We'll talk a bit about plasma protein therapies. We'll discuss how complex the manufacturing process is for immunoglobulin and plasma therapies. And we'll talk a little bit as well about the supply and demand and how that comes into play when we talk about donation of plasma. Next, please. So IgNS is a healthcare association that is dedicated to the practice of immunoglobulin. And our goal is to provide education to guide clinicians' practice, to provide standards of care and all kinds of resources to clinicians to make sure that the care that we provide as healthcare professionals is safe, effective, up to date, and standardized. So no matter where you receive immunoglobulin therapy as a patient, you have the same level of utmost safety, efficacy, and a really good clinical practice. At the center of everything we do, of course, it's you, the patients. A lot of programs that we develop include patients as well, but everything that we do really boils down to one thing: ensuring the safety of our patients. Next, please. Before we get started with our program, I just wanted to steal a little bit of time and invite you all personally to join the IgNS 4th Annual Patient 360 Virtual Conference. Normally we have it face-to-face, and of course this year, due to the circumstances, this meeting is virtual. Patients and caregivers are invited to register. It's completely free of charge. Everyone receives a full scholarship. And attending Patient 360 means meeting patients with different diagnoses, getting information that's up to date from expert speakers, participating in discussions about immunoglobulin, side effects, how to reduce them, how to appropriately infuse. We talk about insurance and reimbursement and what happens when you lose your insurance and have to switch to another plan. And we talk overall about your wellness. We have an expo hall full of top companies in the immunoglobulin field that are ready to talk to you and exchange information and knowledge and their programs. We have a lot of Q&As and networking opportunities with experts between patients, and it helps answers all of your major questions. It helps build helpful connections. It's a really, it's a great conference, and we're really proud of how much it's grown in the last 4 years to date. And so we really invite you to join us and let your voices be heard and participate in the Patient 360 survey as well. So all of that information can be found at ig-ns.org/patient360. That's on your screen. And this information can be made available to you afterwards as this is all being recorded. So you'll always be able to look back. Next slide, please. So let's get into our program and why we're here today. What are plasma protein therapies? Next slide, please. Let's take a little step back before we get into the plasma protein therapies. What is plasma? I know we've heard this term, especially recently. That term has been really mentioned a lot in the news as we find COVID-19 therapies. So what is plasma? Plasma makes up about 55% of our whole blood, and it's composed basically of 92% water, about 1% salt, sugars, fats, and 7% are those vital proteins like albumin, immunoglobulin, clotting factors, and that's what we really want to focus on today. Plasma helps maintain blood pressure and volume. It supplies critical proteins and clotting factors to the rest of your body and carries electrolytes and helps maintain proper pH balance. So plasma is really important. Next slide, please. Out of plasma, we can derive a pretty broad range of therapies, all of which are life-saving, all of which are administered to patients without which those patients could likely not survive. These plasma protein therapies can only be derived from human plasma. We don't have a way of manufacturing them in a different fashion. Albumin is one example. Immunoglobulin is the one that we're going to talk about in this program. Alpha-1 antitrypsin and coagulation factors, some of which are recombinant now, but many are still used in the plasma-derived methodology. Next slide, please. So Ig therapy, as you probably know, is derived from human plasma. It contains highly purified immunoglobulin G concentrate, or gamma globulin as it sometimes is called, or IgG, which is essentially another word for a broad range of antibodies. Ig works through different mechanisms depending on what disease we treat, which is very different than most other therapies. So Ig therapy can replace immune globulin in patients with immune deficiencies, or it can suppress an autoimmune process in patients with autoimmune disorders. It is infused either intravenously or IV or subcutaneously or SC. Next slide, please. Ig therapy is used in a variety of clinical indications. And by that, I mean over 70 clinical applications. It has demonstrated in clinical trials efficacy and safety in primary and secondary immune deficiencies, autoimmune disorders like multifocal motor neuropathy, myositis, myasthenia gravis, hematologic disorders, dermatologic disorders, and even organ transplantation. And the list goes on. This is by no means an all-inclusive list. So you can understand that this therapy requires an ample supply if we're going to treat all these different patients, all of whom depend on Ig therapy to treat their conditions. There's also a lot of ongoing research in this space. It's a very hot space right now. There are a lot of clinical studies. This product is safe and it's effective in such a large number of different indications with such different mechanisms that this is a field that is continuing its research year after year. And demand for Ig therapy actually increases over 20% year after year. Next slide, please. So how do we manufacture what we sometimes call liquid gold? Because it truly is. Next slide, please. if you've ever heard the expression vein to vein, which I think most of you have, what it means is the time it takes from the point of plasma donation, so when plasma leaves the donor's vein, to the point where it enters as a product into a patient's vein. That time period is 9 to 12 months. That's astounding. Only in this plasma biologics, plasma protein therapy area do we have such a lag and such a long, complex manufacturing process. And our process includes, so from getting the plasma all the way to manufacturing Ig therapy, along with other plasma biologics, we have a multitude of steps, including fractionations, purification steps, chromatography, precipitation, filtration. There are viral and pathogen inactivation and removal steps. That should give you a lot of comfort knowing there are multiple steps in the manufacturing that are there only to ensure the final product is completely safe. But it also tells you that this production cannot simply be turned up. Because it's so complex and because of how long it takes, we can't be as nimble as we like in increasing the amount of the volume of Ig that we produce, the amount of product that's on the market. And it also takes years to open a manufacturing plant because of all the regulatory steps that have to take place in order for it to get licensed to manufacture a safe therapy. And so we have a growing demand, and we also have a supply situation that we need to continually plan for years and years in advance to keep up with that increasing demand. Next slide. So if we looked at this globally and thought about what actually impacts Ig demand and supply, on the one hand, what is driving this increased demand? It's new research, new indications, right? It's better understanding of therapy and where it works and finding new applications, and new regulatory approvals. That means new products that are entering the market. And we've had a number of new products come into the US market in the last several years. On the supply side, new Ig brands entering the market increase our supply. That's good. We plan for manufacturing capacity to be increased. That's also really good. Companies invest a lot into increasing manufacturing capacity to keep up with the demand. There are some regulatory issues that can happen. FDA does take a long time to approve new products. Sometimes they have additional questions, and products that we anticipated to come into market take longer. Sometimes whole lots of Ig therapy product can be taken off the market, whether it's voluntarily or through FDA for a variety of issues. That creates definitely a decline in the supply for the time being. There are various manufacturing interruptions that can happen. And finally, plasma supply. Plasma supply can increase or decrease depending on what is going on. So obviously we know it's a critical starting material, and that's the limiting factor. So we can't move forward with production of life-saving therapies if we don't have enough plasma. And plasma supply simply depends on the generosity of donors. And that's why donors really, truly save lives. Donations, we know, decrease during situations in national disasters or like what we're having right now with COVID-19 pandemic, or regional situations like storms and earthquakes. And knowing that it takes 9 to 12 months to manufacture Ig therapy, what happens right now with plasma supply will affect our product availability and supply about 12 to 18 months later. So that is very, very critical. So I'd like you to keep that in mind as we continue through presentations. And I'm going to hand it over now to Michelle Vogel, who'll talk more about the supply, demand, and other issues that are important to us.
Thank you so much, Dr. Sobolevsky. Very interesting information, very important information. As you mentioned, Michelle Vogel will be talking next. She is the Vice President of Patient Advocacy and Provider Relations at CSI Pharmacy, and she's going to discuss the status of immunoglobulin supply and preventing another shortage. Hi, Michelle, and welcome.
Thanks, Jerry, and thank you for having me here at MSU. As many of you have met me before and know a little bit about CSI Pharmacy, I just wanted to remind you that we are a nationwide specialty pharmacy founded by pharmacists and dedicated to providing services for patients with chronic and rare illnesses that require complex care. Next slide. Our patients' communities include CIDP, myasthenia gravis. We have about 30% of our patients have a form of myositis, either necrotizing myopathy, polymyositis, dermatomyositis, and we do treat children with juvenile myositis. We have pemphigus and pemphigoid, primary immunodeficiency diseases, and others that require immune globulin therapy. Next slide. So I was on this platform, and I think it was August, where we talked about supply of immune globulin. And 2019 was a really tough year for access to IVIG. Shortages were reported on most of the brands of immune globulin in most sites of care. The shortages led to patients being denied their IVIG in hospital outpatient infusion centers and independent infusion centers. We saw some cases of home infusion being affected as well. Patients who were really in the hospital outpatient setting those settings were closed down, and especially for children. And patients were prioritized based on their diagnosis. And we know that most of the autoimmune patients were not on a priority basis. So patients went even up to 3 months without getting their therapy. Next slide. 2020 is looking much better because we're in a recovery stage. We're seeing most of the brands that are available in most sites of care, but we do not have a surplus of product. So all of these brands are on what we call allocation, except for one brand in the market right now. And that means the manufacturers work closely with the distributors to make sure that patients who need this therapy get it and that there's no excess product sitting on a shelf somewhere. New brands are coming into the marketplace, which is fantastic, but they are on a limited distribution basis, so some patients may not have access to those products right away. Next slide. Why did we have a shortage in 2019? Well, there were multiple problems. There were some manufacturing problems with a number of the manufacturers, and we had shutdowns during some of the year. Every year during the summertime, the manufacturers close their factories for a little while to go through a cleaning process. But we did see some problems. We saw some recalls. As Luba discussed, we're always seeing an increased demand, and I think that's really great because we know that more patients are getting diagnosed with these diseases, more doctors are aware of this therapy and how wonderful it works for patients, and we're learning more and more about new diseases that the therapy can help. But we have to remember it comes from plasma, and so we need people to donate plasma to have enough product to treat patients. And so even in 2019, we didn't have enough plasma to meet the demand. Next slide. So this is a big question that's been coming up. Is COVID-19 going to cause another Ig shortage? And so the answer is not easy to give you. It depends. Right now we're seeing plasma donations down. and we're all sheltering in place. And so a lot of people haven't been able to go to the plasma donation centers or just don't feel safe leaving their homes. And so in April, we saw donations go down by 25%, which is really significant. We know that the plasma collection facilities are safe to be at, and everybody's wearing all the personal protective equipment, and patients are wearing masks and they're distancing patients. So it is a safe place to go. With the economy the way it is, and a lot of people not being able to work right now, may have been furloughed, it is a place where you can get income as well. But if we don't see plasma donations go up at this point and increase, we could have a potential shortage hitting us again in 2021. So that is concerning. Next slide. And this is a slide I love. Medicine that keeps me going is made from donor plasma, and help prevent a shortage, please consider donating. And that's where we're going to take you on to the next presentation with Rachel, who's going to talk to you about how we can all make a difference.
Thanks so much, Michelle. Like Michelle mentioned, we'd like to introduce Rachel Coletta, the Director of Educational Resources at the Immunoglobulin National Society. And she's going to discuss the It's My Turn campaign to increase plasma donations. Hi, Rachel, and welcome.
Thank you. Thank you so much for having us here. It's a really important time. Luba and Michelle set me up perfectly for what I want to talk to you about. Before I kind of dive into the It's My Turn campaign, I just wanted to talk for a second about where the idea came from. In the beginning of March, when we pretty much realized that COVID-19 was going to impact the entire world, everything was shutting down. Nobody was leaving their house. Even though plasma donor centers remained open and are still open, they're considered essential. And plasma donors are also considered essential. We knew that there was going to be a lot of fear-based decisions about leaving the house at this time. So our bright idea was to come up with a campaign that told everyone, leave your house, go donate plasma. And it probably sounds counterintuitive, but it was actually the perfect time to start this campaign. It's a critical time. As both Luba and Michelle have mentioned, plasma donations are down. Patients that rely on these therapies can only get them through the commitment of plasma donors. So I need your help today. I'm going to get to that in a little while. While many of you may not be able to actually donate, you have no idea the power of your networks, your communities, and your words. And so we're asking you to help support this campaign today. So let me talk about this campaign. It's My Turn. We started this campaign with the idea that we are going to get first-time donors out to the plasma donation centers. I didn't want us to just say, go donate plasma, because IgNS says we should all donate plasma. A lot of us at IgNS decided we should also donate plasma so that we could actually provide the education around the process, around the safety measures, everything to make people know that it's okay to do. So I started donating immediately. I left my house Mondays and Thursdays in the broad daylight with all the neighbors peeking out of their curtains, probably saying, where is that woman going? After about 3 weeks, I put a note on my door that said, I donate plasma Mondays and Thursdays, hashtag it's my turn, hashtag be a hero. I don't know if I recruited anyone, but the glaring stares did stop as I left my house. What's so special about being a donor? I've been a nurse 32 years, never donated plasma, didn't know anything about the donation process. So I was scared. I was scared to go out. I was scared of what was going on in the world, but it really empowered me. It empowered me to educate donors about why we need you, why we need your plasma, where's your plasma going, how can you help people? it allowed me to educate people about the donation process. And also, our number one focus is that our donors feel safe going. So it also allowed me to educate donors, to empower donors to walk into a donation center and have a safe and successful donation. Next slide, please. So I get a lot of questions. I love getting questions because that means people are actually thinking about donating. And if I can be a part in the decision-making process that allows somebody to become a donor, bring all the questions to me that you need. My email address will be at the end of this presentation. I encourage you to use it. The biggest question I get is, and actually I've read through some of the questions that are coming in, so hopefully I can answer some of that now. How do I donate? Where's my plasma going? Where do I go to donate? And there's a lot of confusion in the media right now. There's a lot of talk about plasma donation, which is great, but it's causing confusion. What I want people to understand is that for a donor to help someone who relies on plasma protein therapies to live, they must go to a qualified plasma donation center. There are over 800 of them in the United States. To find a donation center, visit www.donatingplasma.org. This is the only way you can ensure that whoever's donating plasma for you is going to the place where that plasma is going to matter. There's no way that we can figure out where each donation is going. So if your husband is donating for you, that certainly doesn't mean that you're going to get the plasma that he donated. Every lot of plasma has between 10 and 60,000 individual donors. So this is so incredible that we have the gift to not save one life. We have the gift within us to save thousands of lives with every donation that we give. So remember, we need to send people to plasma donation centers. It's called source plasma. That is plasma that is used specifically to manufacture the plasma protein therapies that we need. Next slide. The other question is, can I donate if I have? So I put together a small list. This is by no means an all-inclusive list. You cannot donate if you have diabetes, any kidney disease, if you have an autoimmune or an immune deficiency, or a bleeding disorder, or actually any kind of disorder of the blood. You also can't donate if you take medications like blood thinners or immunosuppressants or experimental medications. And there are many more things that would defer you from becoming a qualified donor. My best advice to you is to call that donation center ahead of time if you have any question about whether a condition that you have would preclude you from becoming a donor. Please know before you go, and you'll hear that phrase throughout this conversation. Next slide. Okay, so the next question is, what do I have to do to be a donor? I can answer this one a little easier. You have to be between 18 and 69 years of age. You have to weigh at least 110 pounds and be in good general health. You also have to provide identification and proof of residency. And when I say residency, what I mean is that you have to live within a certain radius of the plasma donation center that you're going to. Plasma donor centers rely on the communities that they're located in to get their plasma. So once you're assigned a plasma donor center, that's your home. That's where you go. If you move, if you go away to college or whatever kind of extenuating circumstances, you can transfer to a new center, but in general, you will have a home center. You have to pass 2 health screenings and also have 2 negative viral screenings. And this is for safety. This is for the safety of the plasma before it moves on to manufacturing processes. No one-time donations are used. So if you go in or someone goes in to donate and they never return, that donation is wasted. Plasma donor centers rely on the commitment of the donors that are coming into the plasma donation centers. Every donation is held for a period of time to make sure that nothing new has shown up in the plasma as it's being stored. This is also a safety measure. And this goes back to the topic that Luba was discussing about how long it takes to make these therapies. They don't even leave the plasma donation center for 60 days. So that is just the first step of their journey. Every donor is entered into a national donor registry. This prevents people that should not be donating from ever donating. So if somebody has, for whatever reason, should not donate, they can't drive down to the next town and go into that donation center. They're permanently deferred. Next slide. I get questions about the donation process. So we're going to roll through this a little. Just to give a little bit of the information that I know has helped me in my donation process. The day before I donate, I always hydrate. I overhydrate, and I make sure that's not with alcohol or wine, even though that would be enjoyable. It's not as good as water. And I always make sure that I get a good night's sleep before I go to the plasma donor center. Next slide. The day of the donation, again, I'm hydrating all the way up to the time that I'm getting there. I also have a healthy meal, and it should be something high in protein, and try to avoid junk food for that meal before you go in. Next slide. So the plasma donation process, I'm just going to break it into two separate categories, the first donation and then everything after that. Because the first donation generally takes a fairly long time. You can be there up to 2.5 hours, maybe less, maybe a little bit more. But the first donation, you get a thorough physical assessment, an in-depth medical and surgery history. You have to make sure any medications that you're on, you have the doses, you have all of the dates of your surgeries. The donor fills out an extensive donor questionnaire. And again, this is for safety reasons. You move on, you get a finger stick procedure done to check your blood count and your protein levels. And if everything is good, then you move back to the donation process. The donation process itself takes only about 45 minutes. So it's just that first donation that takes a little bit longer time. Subsequent donations, you go in, you fill out, I call a light version of the questionnaire because it only takes about 5 minutes to fill out. You get your finger stick. You make sure your blood count and your protein levels are good. Another thing is they weigh you every time. And the reason they weigh you is because that's how they know how much plasma they're going to take from you that day. And again, if everything's good, you move on to the donation process. The donation process consists of a technician assessing your veins, connecting you to a plasmapheresis machine, which basically takes the blood and separates the plasma from it. So you get back everything red, all the red parts of your blood come back to you. They only keep the plasma. They also give you some extra hydration. So you don't walk out of there feeling tired or dragged out because you've gotten most of the fluid back in addition to extra hydration. You have to be active. When I go to donate, I take a little squeezy ball because you have to pump your fists when the machine tells you, and it will remind you if you're being lazy, and it actually slows down the process if you're not actively participating. Then when you're done, you just get bandaged up and you go. Next slide. Safety first. Donor safety is our #1 priority. Again, we don't want to send people out into an environment that they feel unsafe. And these are tips and tricks that I've learned from my donation. Make sure the donation centers are physical distancing, meaning there's not a lot of people hanging around the waiting room. What I do is I wait in my car until it's time for my donation. I go in exactly at that time. That really prevents any kind of waiting in the waiting area. Make sure they're using infection control measures. Obviously, you're going to have a mask. Everyone in there should have a mask, and they should be wearing gloves. And I think something that's really important is that even if donor centers say that they are taking walk-ins, it's really important to make an appointment for yourself. Making an appointment guarantees you a time slot, and the whole goal of this is to limit the amount of time that you're staying in the plasma donation center. Next slide. Okay, so I told you we needed your help, and this is how. You can help so much by mobilizing your networks. Just ask. Ask your friends, your families, your coworkers, neighbors, anyone you come in contact with. Ask them to donate for you. Again, you may not be getting their plasma, but their donation is saving thousands of lives. Make people understand the importance of plasma donors. Make sure that they understand the importance of keeping the plasma supply. Right now, the supply for next year is uncertain. By spreading the word about this campaign, we can change the trajectory and get rid of that uncertainty. We can turn this thing around. We need your help. Refer them to the www.donatingplasma.org to find their plasma donor center. Make sure they understand that is where they need to go if they want to help you. Post about this campaign on social media. Talk about it. When you get back out in the world and start socializing again, make sure you're telling your hairdressers, your nail technicians, anyone that you run into, the importance of plasma donors, how essential they are, and how they can be a hero and help save lives. We need to act now to keep the supply of plasma flowing. Next slide. And again, this is just some of the support that we've gotten. We've gotten overwhelming support. We have nurses donating. We have spouses donating on behalf of their wives. We've gotten industry support. My son actually went to donate plasma yesterday, which made me so very proud. So we're getting a lot of traction with this, but we really need to continue spreading the word about the It's My Turn campaign. Thank you so much for listening. I'm going to pass it back to James.
Thank you so much, Rachel. Love your passion. I think that's going to speak volumes to many people listening and when we share this. And thanks for donating.
Thank you.
So up next is Dr. James Sheets, who is the founder and CEO of CSI Pharmacy. And he's going to discuss CSI Pharmacy's efforts to increase plasma donations, including their employee plasma donation campaign. Hi, James, and welcome. So glad to have you.
Thank you, Jerry. I appreciate you having me. And to all of you out there in the MSU community, thank you for having CSI Pharmacy back on so we can share about this important subject. I just want to say, like Jerry was mentioning, Rachel, it's so awesome to get to follow you in this in this panel because your energy and your passion is so infectious. So thank you for that. You might have left notes on your door and you're not sure if that increased your cause recruited anyone to go donate, but I can tell you your videos have included me, who's been in the industry for over 20 years and have never myself been to donate until I saw Rachel Coletta share on, I don't know if it's LinkedIn or Twitter, but a video about, how it went for her. So that's fantastic. Love the energy. We'll try to keep building upon that. I'm not going to talk much about CSI Pharmacy. Some of you know who we are. We've been here before with this community. Michelle talked about us briefly, and I think you guys all realize why this is an important subject for us. And so, like Luba was discussing, when you have these certain events that can reduce plasma donations, for those who work with immunoglobulin therapy and other plasma proteins. It can be concerning because we care deeply about our patients. The last thing I want to do as a pharmacy provider is, have to tell a patient that, we're not able to provide them with their life-saving therapy. I don't even want to have to tell them that there's a brand change. I like them to stay on the brand they've been on that I know that they're doing well on, so much less telling them that the therapy wouldn't be available. And so, with that being said, we thought at CSI Pharmacy, what can we do to make a difference? And awareness is awesome, and awareness is important. And we've got a great advocacy team that really from the very beginning started bringing about awareness. But, like Rachel said, I felt like action was important and setting the example. And so what we did was create our employee plasma donation program. And it's actually a pretty easy thing to do when you have pharmacy employees and nurses who work with rare disease patients. They're already kind of invested in the patient community and want to see this therapy be provided. So what we did was decided just to give them a little bit of a nudge, like, like what Rachel had given me to go out and donate for the first time. And so what we do is employees can donate at least the first 3 donations while on the clock, so that's just a little extra incentive to go do it during normal working hours. They work it out with their supervisors. That's been successful. We have a big contest. So whoever donates the most times in a 3-month period, which we're going to measure this at the end of July, is going to receive a nice cash prize and recognition, within a company event. Everyone who donates gets a plasma donor T-shirt that we have created specifically that recognizes them as being a plasma donor at CSI Pharmacy. And then finally, one thing we had to realize a little early on is not everyone can donate. Not everyone's allowed to donate, and we didn't want those folks to be left out. And so we created a program where they can recruit a friend to go in their place. Recruit a family member to go in their place, just like many of you can do. And those people participate in the program just like the rest of them, get their T-shirt and recognition. Next slide, please. And I got to tell you, I've been really, really happy with the entire staff. This is just some examples of some CSI employees, everywhere from pharmacy to nursing, purchasing, pharmacists, all going to participate in this initiative. And another thing I think is kind of nice is that with, having nurses across the country and advocacy team members across the country, we're able to kind of donate to all the various manufacturers, kind of represent all those areas, which is nice to show that we're supporting across the industry. Next slide, please. Another thing, so the first thing was the program. Well, what we want to do is challenge other companies and organizations to do something similar. Make it your own, but take on this worthy cause. We know patients rely on this therapy. We know it's a life-saving therapy. What a great opportunity for you to be able to really give back. And at first I thought, well, we'll talk to companies within the IG industry because they're already, really invested in the patients they take care of. But then really everybody is. I mean, if you'll look at other companies out there, there's probably not one who doesn't have an employee who has a family member or an employee who has a rare disease or knows someone that relies on plasma proteins. So, all organizations, we encourage you to do something similar. Make it your own. Let's do this together. Next slide, please. The next thing we were able to do, so kind of part 2 here was to partner with IgNS. And, the Immunoglobulin National Society is a wonderful group. CSI Pharmacy, I truly believe, would not be where we are without them. And they take so much passion, just like you've seen with Rachel, with this in particular drive into advancing IG therapy. And so when they created the It's My Turn challenge, we instantly wanted to partner up with them, and which is another thing that I think any other company out there should want to do and could do, and will find IgNS to be great partners. Next slide, please. And then finally, it's all about bringing about awareness. And our advocacy team has been terrific. I don't know if you've seen any of the blog articles that Linda has written or any of the newsletters that LaDonna is sending out and other social media posts Michelle's working on, but they've really made this their go to increase collections out there to bring about awareness. And so like our post on social media, share our post, follow the hashtag It's My Turn. Some of these posts we're really trying to design at education. For example, this particular one you see here is explaining some of the differences between donating blood and donating plasma, which I think is very important to understand. But our plan is to continue to post these, to bring about awareness, to continue to share about our employee program, and just partner really with with other companies, and then with you as a patient community, where you have so much ability to reach out to your network and really get other people involved. We want to ask you for that. You've always helped in other times, and you've really come together as patient communities, and I have no doubt that this will be another initiative that you guys will get behind. Next slide, please. And then that's going to bring us to the most important time, the question and answers. Before we get to it, I just want to quickly point out to one link right there at the bottom. Find a plasma donation center near you. So you can go to that link. It'll be at the end of this into this presentation here under the questions. If you have a company that wants to participate and they need to know where plasma center is close to maybe the company, the headquarters, or employees, they can go here. Your family members can go here. And it's a great way to find a center where, like Rachel mentioned, you know that the plasma is going to go to plasma products and to helping other patients with rare diseases and yourself. Thank you.
Thanks so much, James. Appreciate the information and great job on creating the employee campaign. And like you, I encourage all organizations and companies to create something similar. So with that, we'll move on to the questions and answers session. And I first would like to just ask a question. You had mentioned donating blood versus donating plasma. What's the difference?
So when you donate blood, as if you go to the Red Cross and you donate a unit of blood, if you remember Luba's slide at the beginning of the presentation, it showed your blood. It showed all of the contents. So you're giving everything. You're giving everything. And generally, they're not separating it out. They're keeping it as a whole unit. And blood donations are always needed. There's always a critical shortage of blood. And again, that's a great way to help if you don't have a plasma donation center near you. Any form of donation is a way of helping. But donating blood is something that you can only do once every 56 days because it takes your body a long time to bring back all of those components to your blood. Whereas plasma donation can be done twice a week because plasma regenerates much more quickly than the rest of the components of the blood.
Thank you. Could somebody donate plasma at, say, a blood bank?
The American Red Cross accepts plasma donations, but only a type AB blood. So they have a program called Super Plasma. And again, at the Red Cross, they take blood, they take platelets, they take plasma with people with type AB blood. Just remember, this blood, these donations are not going to the manufacturer of the plasma protein therapies. But as I say all the time, if that is the only option and that's the closest thing and that's the only way you can contribute, absolutely make a donation where you can.
Yeah, and I want to just echo that. We've found that a lot of patients, family members, have been donating also at hospitals, and they accept all types, and they thought that they were donating to make immunoglobulin therapy, and you really have to go to a plasma donation center for it to be used for these purposes.
You mentioned that IVIG is safe and effective for myositis, but is it FDA approved for that indication?
It's not FDA approved, but there are clinical trials. So there was a clinical trial by Octapharma to get an on-label indication for dermatomyositis. CSL Behring is doing a clinical trial for the sub-Q version of immunoglobulin called Hizentra. And so I would say we're going to see a on-label indication soon, but it is medically effective. And so most insurance companies will cover it if you meet their guideline criteria.
And I just want to point out to what Michelle just said, there are, as I mentioned in my presentation, over 70 documented applications of immunoglobulin therapy. And in areas, in disease states where we see a high level of evidence, that means we've had clinical trials conducted. They have shown to be they've shown Ig therapy to be effective in that particular disorder. Then it takes one of the plasma protein manufacturers to invest millions and millions of dollars into a clinical trial, submitting it to the FDA and getting approval. That takes years and millions. And so companies sometimes make decisions on the size of the patient population and whether that indication is going to change anything in practice. We know IG therapy is used in off-label indications. Those 70 that I mentioned aren't all FDA approved. But we know in myositis that there is clinical evidence, as Michelle just pointed out. And so it's sometimes an economics decision for manufacturers to seek approval from the FDA. And sometimes if there's already ample use and ample data and proof that it's effective, sometimes those studies don't take place. They are taking place in myositis, but I just wanted to clarify that a little bit further.
Let's see, Frederick has a question about he's currently using IVIG for necrotizing myopathy, but not taking any other immune suppressants. Would he qualify to donate plasma, being on IVIG?
No, because it's a blood product. So I know personally I can't donate either because I also get platelets, and that's a blood product. So since immunoglobulin is a blood product, he would not be able to donate. But this is where we can ask family members and friends to do it on our behalf. And I know personally I have my whole extended family heading on Thursday to donate. So very excited about doing that.
For asking and for considering. That's so nice that you would even consider donating. So thank you so much.
He also has another question. When you give plasma, do you delete or reduce your own antibodies?
So your antibodies regenerate very quickly. So usually we produce antibodies on an ongoing basis, and your body has a lot of signaling mechanisms that can upregulate or down, depending on what's going on with your body, the production of immune globulin. That's also one of the reasons we infuse it every 3 to 4 weeks, because that's how long it can live in our body, even if it's infused externally, so from another source. And so it's generally considered to be safe. But that's one of the reasons, too, that patients with immune deficiencies and autoimmune diseases cannot donate, is that we simply don't know what effect it will have on the patient themselves. So it's partially to do with the fact that IG is a blood product, but it's also having patients' well-being as a priority.
There's a couple of questions regarding IG and COVID-19. Somebody has heard that it's being used as a treatment for COVID-19.
It's being investigated as a treatment. That's true. There was 3 cases reported in China first to help patient with significant pulmonary disease, significant lung dysfunction during COVID-19. Out of those 3 patients, we have a study in San Diego. I believe there are 5 patients receiving IG and 5 are placebo or regular standard treatment, not placebo. And FDA just issued an emergency IND. That means they approved a clinical trial to begin for indication, meaning a trial will start it's in severe patients with COVID-19, and that trial is supposed to start anytime now to understand its effect. The mechanism is really thought to be suppressing this immune overreaction that happens in patients, some patients with COVID-19, the ones who end up needing a ventilator and become very critical. It is thought that the lungs and other organs shut down because the body is overreacting to the viral load. And that's where we think currently IG has a place potentially in therapy, is in this percentage of patients. It's a small percentage. I know that we hear a lot about these very critical patients, but most patients with COVID do not get to that point. But in those critical COVID-19 patients, IG is thought to help suppress the autoimmune, this overwhelming immune response, or it's also called cytokine storm. but the data is very early. We actually haven't seen US data yet, neither from the San Diego study in 5 patients, nor obviously the trial that has not begun. I know that there are a lot of questions. Usually this leads to the supply question. Will we have enough supply? I would say that, first of all, we don't have data yet. It's too early to see if it's even a potential therapy. And if it is, it's going to be a great option to save the patients who need it and are otherwise declining very rapidly. So it is being studied in very serious COVID cases.
And it would be short-term therapy, correct, Luba?
Pardon?
It would be short-term therapy
yes,
for
it
those
would be
patients.
Short-term. Yes, so it would be short-term in a limited number of patients, even if everything worked very well. And so we don't see this as a threat right now because we don't anticipate this pandemic to also continue to be present for a very extended period of time, God willing. So we're watching and anticipating results. It's certainly very interesting, but it is a short-term study, a short-term application. There are also other types of therapies being explored that are plasma-derived, to which, and it's through the same donatingplasma.org that Rachel was talking about. A lot of the plasma therapy manufacturers have begun collecting plasma from donors who have recovered from COVID-19 and making an antibody against COVID-19 alone. So not the broad spectrum Ig, but just IgG against COVID-19. That study is being conducted by a group of 10 manufacturers together and several groups of other manufacturers in collaborative efforts. And so we expect a therapy and some good results from that. And that will probably become more of a feasible option. But obviously, because Ig therapy is on the market now, it made sense to study it and see if it potentially has a place.
So Jerry, I have a question, and there's also one in the Q&A, and that's about age. I'm 74. Why can't I donate?
I think it really has to do with the safety of the patient themselves. I think some of these decisions are, I don't want to say arbitrary because obviously there's a lot of thought that went into them, but some of the cutoffs, is a 65-year-old person who isn't in great health versus a 74-year-old who's in great health, and how can these decisions be made? But I think statistically just had to look at the population and make some decisions. I don't think there's anything really beyond that.
So could you repeat, if you qualify to donate, how often can you do that?
You can donate up to twice a week, and there has to be a 24-hour period between donations. So if you go on a Monday, the next time you could go would be Wednesday. And then after that, the next time you go would be the following week, because you can only go twice in a week's period of time.
Then another just add on to that, because I don't think we've mentioned it too much, was that one interesting additional incentive is when you donate plasma to the plasma centers, they pay you for your plasma. And so I know a lot of our team members at CSI Pharmacy have found out not only are they doing a good deed and getting to start out doing it as part of the employee program, but they plan on continuing doing it. For one thing is that it has the extra incentive of continuous income when you donate.
Yeah, it was actually set up to pay for people's time. So instead of the actual product. So since plasma donations take longer than blood donations, companies are allowed to pay people for that.
It's a great incentive. And that leads into another question about potentially that college students. Question here is, I want to donate plasma, but the donation center closest is more than an hour away. Is there a way to get a plasma center set up in my area where there's a major state university and potentially lots of students who would like to make some extra money?
Yeah, and that's important. I mean, you have to be living within a 60-mile radius to a plasma donation center for them to accept it. And many of the centers are located around college campuses because you have young, healthy donors. And so I don't know how, I mean, we're seeing more plasma collection centers opening up. And so I'm not sure how you would go into requesting that, but I know that that's a major area for manufacturers to open up those centers.
Yeah, and they do a lot of studies on population density and potential availability of donors. So where they open these centers is a whole science unto itself. And so, but I do know, and to echo what Michelle just said, that the manufacturers are setting up new plasma centers all the time because that helps increase the supply. And so keep checking the donatingplasma.org site. I don't know that you can actually request one to be open at this time.
Just 1 year ago, I did a talk about plasma donor centers. And I think at that point I said there were over 700. And so within that short period of time, like these things literally open up constantly. So again, keep checking that website to see if something becomes available.
Okay, thanks. I have a couple of questions here from Joyce, and so I'll just start with the first one. What is average number of plasma donations for donors? Do some come weekly, monthly?
Yes.
Yes.
I can attest to that because when I'm at the donation center, I'm always trying to talk to people. The last time I was there, I met 3 generations of donors. Young grandmother, young daughter, and young granddaughter. The grandmother had made over 1,000 donations. Wow. So these are people, again, I said this when I was talking earlier, where the plasma donation centers are, they know their community. They're based there. So they get to know the people that come into the plasma donor centers. They become like part of the family. They talk to them on a first name basis. And so generally what I find and what I've heard from the donation center that I go to is that a good number of people come twice a week regularly, but a bigger part of people come once a week on a regular basis. What we want and what they want are people to make that commitment to coming twice a week, every week, to get the maximum amount of plasma that we can. I mean, you can donate twice a week, and so we encourage people, if you're going to do it, please make that commitment to finding that time in your schedule to do it twice a week. But yes, these are community-based facilities, and they are friendly, and they know their people, and they know their communities.
And follow up to that, Joyce says, I've had a total of 5 IGs. Approximately how many donors do I need to thank with recruits?
I don't think you could, if you started writing cards today, I don't think you could finish. I mean, we've all heard the statistics about, it takes one donor to treat 130 donations to treat a primary immune disorder, 1,200 to treat other forms of disorders. And again, like I said in my presentation, there can be minimum of 10,000, but up to 60,000 people that go into one individual lot of plasma. So there's endless possibilities. I walk down the street now and I say, oh, I wonder if I saved you. I wonder if I saved you. I wonder if I'm helping you, because there's just so many people that you're reaching. It's, you can donate a kidney or you can donate part of your liver and you understand you're helping one person. When you donate plasma, there's a limitless amount of people that you are reaching with those donations.
And for the autoimmune community, it's 250 donations to treat one person with IVIG for a year.
That's quite inspirational to hear that about your people who are giving like that. I'm going to go back to a couple of questions, and I just underscore something that we've said before, but what is the reason why a myositis patient couldn't give blood or plasma?
Well, they may be able to donate blood if they're not on immunosuppress. It just depends. If you're on an immunosuppressant or on a blood product, you may be disqualified from being a blood donor. So in a plasma donation, it's extensive, the questionnaire and the physical that you go through. So we want to make sure that you need antibodies. So we want to make sure that you're not taking away that from the plasma. So it depends also on the list of medications that you're on to determine that, as well as other comorbidities.
And another more complicated answer to that too, if it's even necessary, is you also have the safety profile of the patients who will be receiving the plasma. And as most of you all probably know, who have been tested for autoantibodies in various forms of myositis, the myositis-specific antibodies and myositis-associated antibodies, those would be donated with plasma as well. And so I'm sure there's kind of a more complicated answer to that. So it's safety for you than safety for others.
And your job is to take care of yourself too, and take care of your condition. And that's why we need to rely on our networks of people that we can ask. It's great. I know so many people have asked me, why can't I donate? Why can't I donate? And that melts my heart, because the desire is there. But we have to make sure that you're staying safe as well.
So transfer that desire and that will to your networks. Get your family and friends involved. Great. And then just a couple final questions, and they kind of overlap a bit. Why is there a requirement or expectation for people to donate regularly? I know that you mentioned once, one donation is not enough. So I guess, why are they asking for that commitment and expectation to donate regularly? And then how much are people generally paid to donate?
I can talk about the regularity of donations. I think that becoming a plasma donor, to me, now that I am one, is almost like a badge of honor. Like, I'm proud. I am essential. And I looked essential up in the dictionary, and it said absolutely necessary and extremely important. And I was like, hey, who doesn't want to be that? So I wear it as a badge of honor. And I think the plasma donor centers rely on a certain amount of people to feel that way. As far as the payment, it varies from center to center. It's modest. It's for the time that it takes that you're giving up. But for the most part, it's important for people to understand that this is just something they have within them to do. Think of it as a more of an altruistic way of helping thousands and thousands of people. But it is important. Again, if you donate once, it's worthless. If you donate twice, you have made a difference, because those donations will be used. But to help people for the long term and for the future, and we see the increase in IG and the demand and the new indications, we need people to understand that this cannot just be a two-time deal. We need people to make it a part of what they do every day.
And that's absolutely the case. And we need our donors to continue to bring our supply up. And obviously these are donors who we know, and we know their health history, and we can check that. And that's another reason for why donors have to continue to come back, because if you donated plasma today and came back next month, and your today's plasma was held, so it wasn't used, you come back next month and you test positive for a virus, they will throw away not only this plasma today, that next month's plasma, they will also throw away the plasma from the prior month because it was held until you've come back again and tested negative for all of the diseases that they're testing you for. So that's really another step that we have in place, and it's complicated, but it is how we ensure the safety of our plasma supply. Because let's say someone, and we have a great example with COVID-19, someone can test negative because it's too early to see antibodies yet, right? So they can test positive a week later or 2 weeks later. The same goes for HIV, hepatitis, a lot of other diseases that don't show up immediately in tests, and the person might be infected. We just can't test for it yet. Mm-hmm. And so there are different tests that are in place. Some test directly for the virus, some test for antibody, but it's an extra level of protection for our patients. And that is how we ensure the plasma that is pooled, when it reaches our manufacturing plant, it is safe. Then there are a lot of other steps to make sure there isn't any pathogen in the final product on top of the already safe steps that we have in plasma collection. This is all for the safety of the donors. And in fact, if any donor is identified as having tested positive for any infection, they are notified by these plasma collection centers. So that's a really important step too. It's a humane step. Someone was donating their plasma, but if they had an infection, they will be notified so they can take appropriate measures. Yeah. But also that donor will forever be deferred. So that's the NDDR, the National Donor Deferral Registry that Rachel was talking about before. That person will never be able to donate plasma again.
Great, thank you. And one final question, actually it's a two-part question. Can one donate specifically to an individual myositis patient, which I think we now know the answer is no. It requires so many people to donate. And if you're a cancer survivor, can you donate plasma?
So it depends on, so yeah, the first part of the question is no, because of the number of donations that are needed. On a cancer survivor, it actually depends on the type of cancer. I believe that anyone with a blood cancer, leukemia, lymphoma, those type of cancers cannot donate because of the blood counts and some of the treatments. I believe other cancer survivors, within a certain period after the last therapy was administered, can donate. I don't know the types of specific cancers and the types of specific treatments that are precluded, but not all cancer survivors are precluded from donation. I think it's just a time period and the type of disease.
Exactly.
Well, that ends our Q&A. I want to thank you all for answering those questions. This has been such a helpful session. If Luba, if you had one final word to put out to the community, what would it be?
I would like to thank you for having that passion to help others, as we could see from all the questions that we've gotten today. It's incredible that people who've had a lot to deal with in their lives, who have chronic diseases and have a lot of other responsibilities, want to help. And I think that's what connects all of us together, is that human nature of wanting to be connected, to help each other. And I want you to really feel our passion for it as well. And we're in this together. We have to do this together. We need plasma donors. And as plasma donors, you save lives. So mobilize, mobilize, mobilize your networks. Post on social media, use the It's My Turn hashtag. use the IgNS hashtag. We'd like to see who donated. We want to reshare. Rachel does videos about people who've shared, and I think it's just so inspirational to see, just like the CSI Pharmacy team has done. It's truly an inspiration. We want you to know that your healthcare community is behind you, and we're here. We want to protect you and fight for you, but you can feel empowered to go into this hand in hand with us, and we welcome you to. So thank you.
Thank you. Michelle, Rachel, James, do you have any final thoughts for the community?
And the only thing I want to say, and I mean, I echo everything that Lupa said. The other thing, I think from what we went through last year, a lot of people felt powerless when we had a shortage. And here's an opportunity to prevent that. And so some things are not in our hands. This is in our hands. And so if we can mobilize the community to start going out and donating more plasma, we're going to have a better chance of having the supply we need to take care of everybody. And that's so important.
Rachel?
I will just say 2 words. Just ask. Just ask. Ask and people will do for you. It's that simple.
Awesome. James?
I would say remember in particular how powerful your voice is and your story when it comes to inspiring others. You know, I've been amazed by rare disease communities ever since Michelle introduced me to the first one, which was a myositis group really 4 years ago. And you carry a great story, and your words and your asking for others to donate, I think, will carry a lot of influence.
Yes, and I agree. We thank everybody. Thank you for such wonderful presentations. Thank you, James. Thank you, Michelle, Luba, Rachel, and thank you on your organizations, the Immunoglobulin National Society and CSI Pharmacy. And everybody, please share. Just ask. It's your turn. We can do this together. So thank you all. And if you have any questions, please. The slide that was up has email addresses. That information will be shared along with the video in the next couple of days, so stay tuned for that. And we, again, just thank you for joining us and for participating. Everybody enjoy the rest of your evening, and stay safe and be well. Thank you.
Thank you.
Thank you.